Good afternoon, charming ladies and young gentlemen. Congratulations to you to be on board, and you're going to go abroad for your further education, further studies, and you've already planned for it, and you've designed and showed that, oh, you're going to be the best ever for your age, what you have done till date. Congratulations again, and I'm going to talk to you about next 1 hour about your various issues which are going to be about your health when you're traveling abroad, if you're studying abroad, if you're staying in the school there or college there, studying there, focusing on what you're doing. I'm Dr. RAJIV MOHTA, basically a pediatrician, and more than that, I'm friend of you all, an adolescent health specialist. I'm going to talk to you for next hour on various issues, which I'm going to show you in few slides for half an hour, and then maybe I can answer your queries if there are any. And these queries will be answered for next half the session. The half session is going to be presentation on the slides which are going to be there. Now these slides are going to talk to you about your own issues, and the most important ones are going to be your own presentation as a candidate, as a student, as a person who can think about or who is showing the world that yes, I am doing the best. So must know health tips for students traveling abroad is the topic today, and health tips are very important. I know you have been talking to various seminars, attending various seminars, talking to various counselors. People have been talking to you about various issues of which college, which university, what subject, what topic, what papers to carry around, how the visa has to be gone around, what scholarship is going to you are going to avail, how much percentage of scholarship or how much money you are going to spend on. But the most important thing is we left out, and that left out tip is going to talk, we are going to talk about it today. It's going to be health tips for students, for you all who are going to travel abroad for further education. Now these tips are going to be travel tips, cultural shock, and these are going to be about the healthy hostel life, health hazards for staying in dorms, and the various issues about what is going to happen to you. See, this is very important to understand that before you travel, you plan for it. Even if you're traveling for a picnic for a week's time, you travel, you organize so many things, you have an itinerary for that, and have you already planned for the travel? But more than that, travel tips is going to be talk about cultural shock, tips on healthy hostel life, and health hazards for staying dorms in the solution. See, your emotions. I'm going to talk to you about physical health, mental health, and emotional health. When I talk about physical and mental health, you will see the slides there. But emotional health, I know you're happy. You're so happy and so content that you're talking to your friends, relatives, and everybody that, yes, I'm going abroad, I've got admission to this university. So congratulations to you again for getting admission and have that sense of happiness. But suddenly something walks in, and that walks in attitude is the attitude of saying that I'm sad. I'm going to a university there, I'm going to be all alone. How am I going to manage myself? And who talks about it? Your parents talk about it, your friends talk about it. How are you going to do about it? So it's the sense of sadness. Then what comes is the phase of excitement. And when you feel like, wow, I'm excited to do and show the world and show myself that I can do better than what I have been doing. I've gone through a school and education, a curriculum. My parents have told me so much enough that you cannot, and now I can show the world that I can. So that attitude of excitement is going to be there. Suddenly what happens is the attitude of independence, that I'm going to be alone, I'm grown up now, I'm going to manage my life. So that kind of fluctuation of emotions from going down and up, sometimes you feel blue and sometimes you feel happy. It's going to be happening here in India when you are in the family. The same kind of blue ups and downs are going to happen to you there when you reach there for at least few weeks before you adjust yourself. So before you adjust yourself for the travel tip, you need to find out what are the tips which you need to go about, and that they are very important. While traveling, get enough rest. See, you have already planned and you've already designed your timetable that you're going to fly a week later. But what you do is till the end day, last day, if you're going to fly tomorrow at 12 o'clock in the midnight, also you're planning, packing your bags. Don't do it. What you need to do is take proper rest. Sleep for more than 8 hours before you board the plane, because when you are going to land there, you are going to have a jet lag. And this jet lag which is going to be there with you is going to remain for a longer period of time if you don't take proper rest. So proper and enough rest, good sleep, good night's sleep is very, very important. So plan, pack your bags a week earlier, prepare things, itinerary is already done, you have 3-4 months left out with you, do it properly. Then when you are aboard, you need to drink a lot of water. What you need to drink is a plain water, not the carbonated water. What you don't need to have alcohol, caffeine, or tannin, which comes through coffee and tea, because that is going to keep you awake. And if you keep awake more than what you should be sleeping, what happens is naturally your jet lag will increase a little more. Eat wisely, eat small bits while you're on the board. You may be traveling more than 3 hours in a plane. If you're traveling more than 3 hours, if you're aboard more than 3 hours, what you need to is get up from your seat, walk a little, jog a little. There is an area in international flights wherein you can stretch yourself a little. There is an open area. That area you need to go on, be physically active when on board. Manage your stress. If you're stressful that how am I going to do when I reach there, stop thinking about it. Say to yourself that congratulations, man, I have got admission into a school and I'm going to go abroad and show myself and show my parents and show my student colleagues or show my peers or show anybody and everybody that I can do it. Now, packing small first aid kit, over-the-counter medicines will help you deal with minor illnesses and emergencies. If at all something is happening, we'll talk about it a little later in the next slide. Then cultural shock is a very, very important thing you need to understand. You are coming from a different background, different culture, and when you're talking about a different culture and a different background, what you need to know is you are going to a country which is going to be totally different. There are various phases of cultural shock, and these shocks, if I talk of the first phase is called as the honeymoon phase. And honeymoon phase talks of that you being happy, you being jubilous, you being jubilant, and what you say to yourself that, oh, I have proven myself, I have proven my parents, I have proven my school that I can reach a country or a school where I can manage my show, and that is what the sense of happiness. Suddenly what comes is a feeling of thud, and you feel lost, you feel depressed, you feel moody, you feel having an attitude of loneliness. When you feel that, oh, nobody is there with me, how am I going to manage myself? Nobody is going to support me. Nobody is there to talk to me. I have come in a country where I'm not able to talk to them because the language is different, because the presentation is different, because their attitude is different, because their ritual and cultures are different. How am I going to manage that? This is what is very, very important. Now, what you do is you try to manage that kind of moodiness, irritation, and unwelcome gesture, which talks of a splurge of crying. You feel like crying. Yeah. If you feel like crying, just cry. Let out your emotions out and you feel happy. Oh, my cry is gone now. I know that I have taken admission into a university and I'm going to study more for my graduation. So that is what is the attitude you need to build. And what more than that, for the second phase, you need to sleep properly, eat properly, and have your day's timetable design, a week's timetable design, a month's timetable design, and that timetable has to have rest. Why? Because you have come into a country where nobody is going to talk to you about anything. Nobody is there to monitor you. Your mom is not there saying that get up at 6 o'clock or sleep at 11 o'clock. So you keep awake for whole night talking to friends or doing something and on the net or whatever you feel like doing. You spend a lot of time keeping awake, being happy, but then next day you are dull, drowsy, and you're not able to concentrate in your studies. What you have gone for there is studies, further education, and what you've gone for there is more of learning and becoming a graduate into some subject which is a subject of your choice. Then comes the last phase of cultural shock, a sense of comfort and understanding of your own country. This is the third phase of cultural adjustment, and this is called as the cultural adaptation. Why adaptation is very important? Because supposing you're sharing your room with a person from different country. Maybe you may not like his approach or your approach he may not like, but that must be the approach which they have in their country. So try to adjust yourself to him and try to adjust yourself. He is going to adjust with you. So that adjustment is very important, and cultural adaptation, once you go through, the cultural shock is going to go off and you're going to say to yourself that, oh, now I can manage my show. It may continue for a week's time or 2 weeks time or a month's time, but shock naturally goes off. And see, what is very important in shock is it is temporary, it is not permanent. It does not remain with you for a month's time. What you need to do is sleep well, eat well, exercise, do whatever you like. Try to find out in campus what is there to relieve your stress, anxiety, pressure, what is there to relieve your shock. there must be a swimming pool, a play pool area, or maybe a ground where you can walk, a jog, or a garden area. What you need to show is if there is a hobby and there is a hobby center, go there. If nothing is proving and you're not able to come out that shock, go to a counselor in the campus, and there is a counselor in the campus who will help you out to come out of that. This is very important. Tips for healthy hostel life. What you need to do is, there is something called as personal hygiene. What has been you have been doing is brushing properly, but have bath every day. If you're in a country where it's warm, you can have a bath twice a day. But if it is a country where it's too cold, you can at least have wash at least once a day, so that you keep yourself, the personal hygiene is good. What you need to do is eat and drink healthy foods, not junk food. We eat a lot of fresh vegetables, salads. It's available in your mess, or it is available wherever you're going to eat. So a lot of healthy foods you need to eat. Less of carbonated water, less of alcohol, less of beer, less of tea and coffee, because that will keep you awake and you're not going to sleep properly. Then healthy habits would be sleeping properly for at least 6 to 8 hours. Then planning your day, planning your night, planning your 24 hours, because again, you are not being monitored by anybody. So you need to plan your time, and the planning of the time has to be consistent throughout the stay abroad, and that healthy habit need to continue so that you are remaining healthy in a hostel. Now, medical kit for hostelers. What you need to do is essential items you must carry from India. The thermometer, it should be a digital thermometer. Then multivitamin caps, if you need that I'm dull and I need to have something in between to pop up, then have certain tissues. Then salt for salt water gargle, or for sore throat, or salt to add to whatever they are giving to eat. Then eye wash liquids are there, then tweezers are there, sore throat cough lozenges are there, which are available over the counter, which you can carry easily. Aches, pains, and fever medicines like maybe paracetamol or acetaminophen, which is allowed to carry anywhere in the world that you can carry. Then allergy medications, if you are allergic to cold or cough, or you're allergic to atmosphere, or allergic to dust, or allergic to anything, allergy medications are allowed to carry. Then cough and cold medications you must carry, because this is the commonest presentation of unhealthiness which you may get exposed to, because the atmosphere is different, the temperature is different, and everything is going to be different. So that way you need to carry those medications with you. So to certain band-aids and bandages, if at all you get injured. Then it's good to have a heating pad or an ice pack which you can refrigerate and use it for the injuries if you get somehow while playing or moving around in the campus. Then humidifier and cold mist you can have, or soup packages and crackers and sunscreen lotions and lip balm are a must when you carry your first aid kit. That is what is important when you carry that. But more than that, what is very important is health hazards which are hidden in the dorms. When you're staying in a hostel, when you're sharing a room with somebody, it's like a petri dish. Somebody of you must have gone through biology, so you know what petri dish means. There are various bacteria, germs are growing in that petri dish. So there are various bacteria and germs which are growing in these dorms. I'm talking about a disease which is very, very important. Why am I talking about disease? We'll come to know the next slide. I'm talking about a disease because this is the commonest disease which is happening, not very common, but if at all happen, it is a very detrimental disease. And I'm talking about meningococcal meningitis. It's like an infection which is going to brain, which is infection which is affecting brain and the spinal cord. And sharing, this happens when you share a tiny dorm room, or cans of beer, which is a common thing to share. It's a surefire way to spread the germs that can cause bacterial meningitis. Like flu, which is again spread through the air droplet infection by kissing or sharing glasses, or sharing certain things which has been used by somebody. Then bacterial meningitis can spread through saliva also. Students living in dormitories have been shown, statistically proven since last so many years, they have 9 to 23% fold higher risk than those staying in other accommodations. So you have a 25% higher risk of getting the disease than any other person staying somewhere else. Now these pictures you may feel are ghastly pictures, but they're actually a photograph of a patient suffering from meningococcal meningitis, a very serious infection, which if it occurs, there could be death within 24 hours. And despite treatment with appropriate antibiotics, 40% can die. So early diagnosis, early management, but more than that, why am I showing this slide? Because I'm talking about the preventive health. I'm not talking about the curative health. When I am talking about physical, mental, and emotional health, I'm talking about the preventive health. Before you launch yourself abroad, before you launch yourself in the university where you are going to study further, you need to protect yourself from various diseases which are prevailing there or prevailing anywhere and everywhere. Right now, from March 2014, there is an epidemic of meningococcal meningitis happening in Princeton University, New Jersey. There are 8 cases which have been diagnosed till time. 8 is a very large number because it's a rare disease. But if at all it happens, it's very difficult to treat if not diagnosed in time. And more than that, if at all diagnosed, there would be 20% survival of meningococcal diseases with complications like hearing loss or neurological disability or loss of a limb. So if you're going to have a handicap because of a disease, why not protect yourself by doing something? Now, what are those solutions? The solutions are: wash your hands frequently, wipe down shared surfaces, avoid close contact with someone who is sick, eat healthy, get plenty of sleep, don't use the common shared beer cans, or don't have that kind of presentation wherein you are sharing the liquids from your body to somebody else's body. And get vaccinated. So vaccination is the preventive measure which I'm going to talk about. The meningococcal meningitis vaccine is available. So let's have that vaccination. In the United States, the Advisory Committee on Immunization Practices since 2005 have recommended vaccines from 2 to 25 years of age. So anybody more than 2 years of age can have the vaccine. And most universities have made it mandatory for all freshmen entering into college to show the proof of vaccination in the past 3 to 5 years. So if you have taken a vaccine, it's okay. If you've not taken a vaccine, then you need to vaccinate yourself before you launch there. So if you have taken a vaccine much earlier, there is a recommendation for the booster also. That booster you can go for. 12 states require the proof of vaccination before high school entry also. So how mandatory it is in the United States, it's mandatory in other countries also. Now, this Advisory Committee on Immunization Practices recommendation for adolescents talks about the vaccination between 11 to 12 years of booster age at 16 years of age. So you need to have 1 dose of freshman entering university if not vaccinated in last 5 years. So at least 1 dose before if you're not vaccinated in last 5 years. This talks of the way, this is the geographical diagram of various states in America, talks of various states making it compulsory for vaccination to have meningococcal vaccines. And there are various states which talk about the education to be given to the students, those who are coming there, and then vaccinate. And there are states like New Jersey, they're showing requires vaccination for new students in dormitories and education for other students. So it's education or vaccination or both together. The vaccine recommended by Indian Academy, IAP is the parent body for all the children up to 18 years of age. So vaccination recommended by IAP for students traveling abroad are MMR. MMR stands for measles, mumps and rubella. So measles, mumps and rubella is resurgent again. What does resurgent means? There is an increase of these diseases, and if at all you suffer from these diseases, you are going to put it in a quarantine there in one of the hospitals there for a month's time, and you will not be able to attend the school there, you will not be able to attend the classes there, and sometimes they may deport you back to India saying that, okay, you're suffering from this disease, we're not going to keep you into the school. And the simple way to avoid these diseases is to vaccinate yourself for various diseases like MMR, measles, mumps, rubella. Then TDAP is tetanus, diphtheria, and cellular pertussis, because diphtheria is increasing again, pertussis is increasing again. Pertussis is whooping cough, like a barking cough, we say that. It's a detrimental disease again. Diphtheria is a dreadful disease. Tetanus, you all know about it. Hepatitis B is a disease which is transmitted through sharing of certain things like razor blades or scissors or certain things which you're sharing, the personal use. These things are not to do like toothbrush. These are things not to be shared even if you're staying in a hostel. What you can share is maybe a tube of shaving cream or perfume, but not the personalized utilities things like razors. Then chickenpox vaccination is a must. Then meningococcal vaccination. These are the recommended vaccines by Indian Academy of Pediatrics. Ottawa University talks of meningococcal policy, and they fill a form saying that yes, you need to have vaccination for meningococcal meningitis. Then you need to consult a doctor before you visit these countries. Now, why you need to go to a consultant? A consultant who understands about travel medicine is very, very important, because before you travel, you need to have certain papers in your hand, certain medications in your hand, a first aid kit in your hand, and these kits will not be allowed unless you have a prescription. A doctor would prescribe you certain medications, and that prescription is a must. So certain things which you need to carry before you abroad is you have to have your health file. which is very important, which talks about the health record. Then your personal medical history, if anything is there which has happened in the past, like you're suffering from diabetes, or you have epilepsy, or you're suffering from certain allergies, like food allergies, or some allergies, or somewhere you may have some disease which need to be monitored by a doctor there or a health personnel there, that has to be mentioned in that prescription. That is very important. Then you need to carry your immunization record, which is a must. We sign almost more than 100,000 vaccination records, wherein we talk about the vaccination which has already been given to this child, a person who is going there, because it's a must for various universities. Unless you do that, they will not accept you as a student, or they may deport you back. So vaccination is a must. Then you have prescription for eyeglasses, then prescription for contact lenses, drug prescriptions if you're suffering from some disease wherein you need to take regular medications like diabetes, then you need to have all these prescriptions with you, and that is very important. So prescriptions are a must. If you're carrying certain drugs for that 1 year time, you need to carry it for a little more time when you're going to stay back. Why it is important? Because once you carry that baggage with you, you are sure that I have the disease, the drugs with me, and I'm going to use them as and when required, or I'm going to use them every now and then, or a daily basis, which has been prescribed by the doctor here in India, that you're going to use there. So carry them properly labeled and sealed. Then it is especially important for you to consult a healthcare provider who specializes in travel medicine if you have a complicated travel itinerary, like current medical conditions, because very important to know what is to be taken, how the drugs are to be taken. You need to have a counseling session, 1 or 2 or 3 sessions, that I'm going to take these drugs on my own, because till date your mom has been giving you the medicines. Now you have to take your medicines on your own. That is very important. You have not done it ever. Now how are you going to do it? So you should be sure of what medications, what drugs, what things are required. How am I going to manage that? You can have a training session on first aid also from this healthcare provider. The first healthcare provider will give you a training for half an hour, that if at all you get injured, what is to be done, which medications to apply, how to clean that injury, and how to prevent and treat yourself from various ailments if you suffer from HIV, AIDS and STD. Very, very important thing I'm talking about. Be attentive and listen to this, because it is very, very important to understand what am I going to talk about, because you go exposed into a world which is an open world. You're exposed into a country wherein the cultural shock has gone now, and you are becoming one amongst them. When you are becoming one amongst them, is going to be a life unmonitored by anybody, and that life unmonitored by anybody could have various peer pressure activities, tactics, wherein somebody may ask you to drink, somebody may ask you to go to a prostitute, or somebody may ask you to share multiple partners. And this is very, very important to understand, that sexually transmitted diseases including HIV and AIDS are among the most common infections worldwide. The most reliable way to avoid transmission of sexually transmitted disease is to abstain from sexual activity, or to be in a long-term mutually monogamous relationship. When I talk on this forum about this, it is very important to understand that you prevent yourself from a disease which is going to convert from HIV to AIDS, and if at all you suffer from AIDS, the life is going to be the next 7 years. You've gone to a country to learn and do something better. So in your life, man, there are many important things than relationship. There are many important things than what you're going for, you may go for. So be aware and try to bring yourself back. See, you are the only one who is going to monitor you, nobody else. So when you're monitoring yourself, you need to be truthful to yourself and say that I have come here for studies, I have come here to prove myself, I have come here to build my life, I have come here to prove my dreams and desires, and I come here to prove my goals and show the world that I can, and I'm going to do that. So that self-talk is very, very important in HIV, AIDS and STD, and prevent yourself from various diseases and various things which you may suffer from. Tattoo and piercing is very, very common, because you may like somebody's tattoo and you may say that, oh, tattoo school is there around, he is doing it free of cost, and actually I need to show that, oh, I'm one amongst you, I'm not Pappu, I'm cool. So when I'm not Pappu and I'm cool, I need to pierce my ear, I need to pierce here and there, and I need to take injections, and I need to have something like showing my girlfriend or showing my boyfriend or showing my friend around that, yes, I'm one amongst you, I can have also tattoo. But tattoo is the most detrimental thing, because needle is being shared by many, not one. So you may suffer from that hepatitis B or HIV, which the earlier person was suffering from, and the same needle is being used. The person may say that, oh, I'm using a different needle, or he may prove to you that, oh, I'm taking utmost care of, but please avoid tattoo, avoid piercing, avoid injections, avoid drugs, avoid alcohol, avoid yourself from womanizing, and avoid yourself from HIV and substance abuse. This is very, very important for you to be a successful person. Hazards of cold and flu. Like I was talking about petri dish and the room dorm. When I was talking about it, I was talking about various diseases which can be commonly shared, like common cold, flu, running of nose, cough, cold. And what happens is we share many things together, and what happens is we get the disease of common cold. And then when we talk about it, according to the Center for Disease Control and Prevention, the most reported cases of swine flu, you read in newspapers in India, the swine flu, somebody gets admitted into medical college and somebody die off. In 2009, where 5 to 24% age bracket, more than 27 cases of between 1 lakh children. And if you suffer from swine flu, it's again a detrimental disease. So solution is hand washing, proven to be useful. Flu vaccination is also recommended by the CDC in all persons above 6 months of age. So you need to vaccinate yourself and prevent yourself from various diseases. The hazards are the mold which can be there in the room and the dorm, and you need to prevent by keeping everything dry. Then binge drinking. Again, I come back to the same topic of peer pressure, wherein somebody, you need to show that, oh, I am amongst you, man, I am amongst your group, so I need to drink, and I need to show that, yes, I can do that. So lack of parents on college campus can truly newly unleash freshmen into binge drinking party animals. You are all going to be party animals tomorrow. Everybody is going to enjoy life there. So life is going to be 365 days, or maybe 365 multiplied by 2. If you're studying there for 2 years. But life, party, yes, you enjoy whatever you feel like doing it. But very important is to prevent yourself from a little excess or little more. More than 90% of alcohol consumed by people under 21 is in the form of binge drinking. That means excessive alcohol. Drinking to excess is extremely dangerous and potentially fatal. It can also lead to problem in the classroom. For every 5 drinks a student has per drinking occasion, his GPA goes down by half a grade. According to a paper published by Impact Teens, a research partnership at the University of Illinois in Chicago. So it's a research proven fact that if you drink a little more than what you can accommodate, what you lose is your grades. Bed bugs. There are going to be bugs around because people are sharing the same bed many years. What you need to do is try to inform the authorities to get that clearance, and they may have some pesticide control, but what more you can do is use your bed sheet, change your bed sheet every day, put it for wash, and you're going to be the person who is going to wash it. So you may feel like, why am I doing so much of homework at home? Because you're going to be the washerman there. So when you are there, washerman, you need to be changing it for your own prevention, because therein various diseases are going to happen with bed bugs also. Now, very important one is the vaccines are available with special offer for CREDILA students at designated vaccination centers near to you. To avail this offer, you need to submit CREDILA loan sanctions number in the designated center. And what you need to do, how can you do it? To conduct nearest vaccination at the nearest center, you need to send this mail by saying VAC, then space, then S is student's name, then space, S is for student, then a space, and the name, your name and city, and send it to 56767, and you will get the nearest contact, wherein you visit the pediatrician there or the contact there, which has been recognized by CREDILA or which has been recognized by the authority or the agency, and get vaccinated. So find out a doctor, find out a travel authority, a person who is good in travel medicine, find out a person who is going to help you out, and plan your itinerary properly, work properly, systematically, plan your baggages a week earlier, and think that you're going to launch yourself into a country of your choice, a country of your school of your choice, wherein you are going to prove to yourself that my past, my future is better than my past, and you're going to prove to the country from which you are coming in. There are many examples all over the world which talk about India being intelligent, India being the superpower, India being the brain behind all the activities which is being conducted throughout the world. So that is very important. Keep that positivity in you, and keep that positivity wherever you are, all 24/7 by 365, and you will be a successful person ever. And again, my charming ladies and young gentlemen, all the best to you, to be aboard to a country, to a school which you love, and be graduate yourself into a subject of your choice, and do the best what you can. And while coming back, also last tip which I want to give is the cultural, the reverse cultural shock. This is very, very important when I talk of reverse cultural shock, because when you come back and you talk to your friends, your mother, father, and everybody about the country you have visited, you keep talking about for a prolonged period of time, somebody may get irritated. I talk about my own example. In 1992, I visited America for the first time. I came back, and after 4 or 5 days, my younger sister told me, now enough of America. So I stopped talking about America. So that gives me a clue that yes, I was talking probably a little more. I don't know. I'm not yet able to manage or think about whether I was wrong or she was wrong or whoever was wrong. But somebody may point you out that enough of enough is now you've come back to India, be an Indian and don't talk about the country. But this is going to linger on. That linger on still remains in you after a year or 2 years. Even if you start working at the age of 40 also, you may remember your American trip or your American study or wherever, which country you've gone to, UK or European countries or wherever you've gone for further education, you may remember that. Keep those memories alive, and to keep those memories alive, reverse cultural shock has also to be adjusted. So man, all the best to you. You're growing up well and you're keeping yourself healthy. So my topic was today about the healthy tips to remain healthy abroad when you are there abroad, when you are there in various universities, study there. All the best to you, and next 30 minutes I'm going to answer the queries if you have. While you're there, you need to coordinate with various agencies, the school, it could be counselor, it could be school health specialist, or it could be somebody who is going to help you out of your stress, anxiety, pressure, tension, or the cultural shock. If you are into that kind of the problem, then you need to think about, yes, if you have a problem, somebody is there to help you out. In campus, health specialists are there. In campus, people are there, those who are going to help you out, counsel you, give you certain medicines, or put you into some health activity, wherein health activity is going to be healthy, wherein you are going to remain mentally, physically, emotionally healthy, and then study properly and get good scores. One very important thing in counseling session is your counseling between the talk between you and your counselor is going to be always confidential. This is what is being told to people. And what is more important is confidentiality is maintained. It won't be shared even with the doctor of that campus. The counselor is not going to share anything. So if you have anything in your mind, if you have anything which you need to share with somebody, the counselor is going to share. You can talk to your parents back home. Need a schedule, design the schedule wherein you can talk to them. You can talk to them often, but the schedule can change. Tell your parents, if I am not able to call you today, maybe there is a seminar, maybe the seminar can happen all 24 hours, anytime your teacher can call you, you can study, you're studying in library, you're not able to do it today, maybe we will do tomorrow. So because otherwise here, if you're not in contact with them, they will be worried, they will be under anxiety, they will be under tension, and they will not know where are you, why are you not contacting. So keep them away from this kind of anxiety and tell them that yes, I will manage and I will call you as and when possible. So talk to them often. Your homesickness will go off and their worry will go off that yes, my son or my daughter who is all alone there is ready to talk to me, or she is there to she is there with me always. A very important thing, a question has come from one Saurav, which talks about vaccination required are determined by the study which is being done there. Why I'm talking about is because if you don't vaccinate yourself, you go there, sometimes what they do is they check your blood and they try to find out if the antibodies, that means the particles which are protecting you from these diseases, if they are existing or not. If they are not existing, what they do is they will give you an injection of the same disease immunity which you don't have, which is going to be very costly there. So that is very important. Now there is a question which talks about, please explain about the alcohol use aboard and what are the restrictions. If I talk about alcohol restrictions, there are in campus, there are various rules are being explained, and there is a logbook, there is a rule book which is being there with the counselor of the counseling session, or the person who is going to be the international student coordinator. As soon as you go in campus, you need to have that book, read that book properly, and there are various restrictions which are different from various universities or various schools. So find out which university you are going in and what are the rules there. What should I do in case of emergency? Whom should I contact? This is being asked by Vinayak. In case of medical emergency, you need to contact the doctor there in campus, or if there is no doctor, they will tell you a number, or they will give you a contact number. There is a counselor there in campus who is going to put you on board with somebody, some doctor who is going to be there, either a public doctor or a private doctor, and they will manage that. They have charged money from you for that. They have already ensured that you have that your health insurance, which is going to cover that money. So it is very important. There is a question which talks about, Neetu Sharma is asking, how many days before should I take the mentioned vaccines before traveling? See, it is very important. Before you board, if you're not gone for these kind of vaccinations, there are going to be multiple vaccinations to be given, like 4, 5 or 6 vaccines at one go. What a pediatrician can give you, or what the health specialist can give you, are 2 vaccines, 2 pricks at one time. So if you're going to have 6 pricks, naturally you need to have at least 6 weeks in your hand. So at least you can visit your consultant or a doctor maybe 3 months, 4 months prior. If you are having a less time, you can still visit and have important vaccinations done in a frequent manner, wherein you can have vaccination two vaccinations today and maybe after 2 days. That way you can go on. Vaccination required are determined by the titer value. This is I am talking about. No, there is a question by Akanksha which talks about all required vaccination provides 6 months immune. No, they are lifelong immune. When I talk about vaccinations for meningococcal meningitis, 2 vaccinations, you are immune for that disease for more than 20-25 years, because the vaccine is 20 years old. And there are 2 doses to go for. Then what medications will I need to take with me? The medications, again Vinayak is then on board and he's talking about what medications. The medications very important are paracetamol for fever, something for allergy like maybe cetirizine, or maybe Benadryl syrup for cough, or maybe some first aid medicine. Brufen is being allowed because it is the over-the-counter medicine in US and various countries. You can have Brufen, you can have an antibiotic ointment if you get injured, like bacitracine or Neosporin. That kind of ointments you can have, and maybe you need to carry certain ORS solutions, wherein you can have ORS drink when you're feeling drowsy or dull. Am I supposed to take all vaccines or only meningococcal meningitis? This is being asked by Mrugesh. Mrugesh, it is very important to take all the vaccinations, because it's not what is being mandatory by the university. You're trying to protect yourself in a country, unknown bacteria, unknown viruses, unknown diseases, and wherein you're going to stay with people from various countries, maybe 20, 30, 40 countries. So you need to protect yourself from all the diseases, and you need to vaccinate against all the vaccines. It's not because you're spending a little money on meningococcal. It's you need to protect yourself. That is what is important. What are the local laws? Local laws, you need to ask for the people there, or else if you are sure of the school you are going in, the local laws will be available on the net, or local laws, the school will give you the local laws here in India before you go there. You can access the local laws, read. If you have a query, consult the school authority, consult the international coordinator, student coordinator, and he will explain you if any query is there regarding the local laws. There is a question by Abhishek Nandangaonkar. He asks, how early should we get the test done for the vaccination to be taken? See, if you are trying to secure yourself, saying that I've already taken vaccination in childhood, do I need to vaccinate myself? Yes, very important is you need to check the blood level of all the the diseases, and once you once you are sure that antibodies are there in your body which are protecting level, you may not go for those vaccinations. But again, to do that, you need to check out a blood, which is going to be costly. It is going to some time. So better way is to vaccinate yourself for the diseases which you feel are prevailing in that country. One question was regarding emergency. See, if I talk about emergency, what is very important is the emotional emergency wherein you feel like lost and you feel all alone. You need to take help from somebody of your age, wherein your colleague will help you out and say that, come out, let's go for a walk, or let's do something which is very revealing, or share some time with somebody. If you are a voracious reader, you can read a book, or you can go for a walk and enjoy the mother nature there in country where you are. It's beautiful there abroad when you go there abroad. Various flowers and beautiful colors are there around. The beautiful nature is there around. Enjoy that nature, and that emotional emergency will go off. If you are homesick, what is very important is that sickness has to be relieved of by talking to parents, talking to mother, sister, but too long a talk or too short a talk will not help you out. It's an optimum talk wherein you say hi, bye, inform them, ask them a few queries, and leave it. For a prolonged talk, you will become homesick after you close down the phone. That is very important. If I have only one day before travel, can I buy the vaccine here and have it aboard? I don't think the agency will allow you to carry the vaccine, and I don't think the people there will inject you those vaccines. What you can do is absolute essential vaccine, you can inject yourself on the same day and then may fly. If we are going in August, how many days earlier all vaccinations should be completed, since they may have side effects also, like right Akanksha, Apodar, it's absolutely correct that each vaccine would have a little bit of soreness where you take the vaccine, a little pain there where you feel like, oh, I've got a pain or I've got a little trouble there. So naturally you need to start injecting from right now. Still August, there are many months left, so you will finish off everything in time. Vaccination needs cold chain, so you cannot carry them. Vaccination mandate by university and not all that you mentioned. Yes, there are various vaccines asked by various universities. If you go to UK, the vaccines are different. If you go to US, the vaccines are different. If you go to Germany, the vaccines are different. If you go to various states in US, like you are going to New Jersey, the vaccine asked for are different. And if you go to Alabama or Albany, the vaccines would be different. So you need to find out which university you are going in and whatever they ask for. If I am talking about 6 vaccines, they are the recommendation from Indian Academy of Pediatrics, wherein they talk about students going abroad and we need to vaccinate. How many doses of meningococcal vaccines are recommended? 2 doses are recommended if you're not vaccinated, if you're vaccinated earlier. If you're vaccinated in last 5 years, only 1 dose is required. Do I allow to travel with fever-like symptoms? I don't think. What you need to do is take medicines, cure yourself, prevent yourself going for certain things like partying before traveling. You need to finish off all the partying, all enjoyments, all fun, maybe 15 days earlier, and need to be healthy before you fly. Because if at all you are proven to be an infectious disease person, they will put you into quarantine, into hospital, and they may send you back if it is an infectious disease like the measles. Or if you're suffering from some disease which may be proven there that it's infectious to that country, they may send you back. Can I get a vaccine from my nearby chemist store? Yes, you can. Where do I go for vaccinations in my city? Neetu Sharma, I don't know which city you belong to, but very important is, yeah, you can go for the slide which I have shown earlier. You can go for the CREDILA centers, and you can ask for find out the nearby center there. Or you can consult a local pediatrician there. That pediatrician will tell you about the vaccinations. Or a travel health specialist, if anybody is there in your city, he will tell you what vaccinations, and he will inject you with the vaccines. And again, repeating this, you can go for the mail on SMS on VAC space S space then your name Neetu Sharma, then space city, and mail it to 56767, and you will get the contact address. Sridhar, you're talking about pediatricians. Yes, pediatricians can take care of you up to 18 years of age. They have been allowed by WHO and UNICEF to take care of you, anybody up to 18. but they can vaccinate you up to 18. If you're more than that, still you can go to a pediatrician, because pediatricians are taking care of the vaccinations in India. Yet physicians are not taking. But some physician, some health specialist, if he is vaccinating you, you can go for vaccinations with anybody. If you have a doctor at home, he can inject you with those vaccines. So no need to go to a pediatrician. You can find out a family physician who can do that. Yes, a family physician would do it. And give certificate for vaccination. Yes, the certification would be valid if somebody is MBBS plus. Ooh, you're asking about the differences of cost of meningococcal flu and MMR in India and US. Yes, the cost would be much higher in US. If you convert it into Indian rupees, it's going to be detrimental. So vaccinate yourself in India. They are very costly there. Vaccination is not being covered by your health insurance. The cost would be 30% higher. Average cost in India would be for various vaccines, various different costs is there. If I talk of meningococcal vaccine, that would cost you something around 4,500 rupees. One vaccine in India. And there it would be more than 7,000 rupees. Whether vaccinations are covered in insurance? No, they are not covered in insurance. I was talking about various emotions being shared. I'm coming back to that again. You need to take care of yourself being alone and proof that yes, you can manage your emotions being alone there. But what is more important, when you're going there, you have a dream, you have a desire. That dream, goals and desires are to be managed properly, and you focus on studies there instead of focusing on something else like friendship, relationship, multiple country friendship, multiple group friendship, and go for partying and enjoyment. Go enjoy your life, man, but focus should not be shifting. The risk factor is very high if you go for such kind of attitude and thought of doing something like this. How about health insurance plans in US? How useful are those and costs? See, I'm not a specialist into health insurance. You need to consult a health insurance agency and they will give you, or maybe you can consult your school there where you got admission, and they will tell you that these are the absolute essential health insurance. But what is more important is buying health insurance in India would be in Indian rupees, and buying health insurance in US is going to be much higher the cost. Thank you, Neetu, for sharing, saying thank you, because I know you're going to launch yourself. Someday when you come back to India, you're going to show that India is a great country. All the best to you. I'm talking to Neetu Sharma. I believe I have been talking to you since last almost 1 hour, giving you the tips of being healthy in various countries, wherever you're going for further studies. I hope I have solved your queries. I hope I have given you proper tips to be healthy, physical health, mental health, where anxiety, stress, tension would be relieved by yourself, and emotional health as well. I was talking to you about the proper physical health, where I gave you tips about how to travel, how to pack, how to have the first aid kit, and what is more important is vaccinate yourself. Thank you, and all the best to you for your future. See you sometime in India back when you come back and you head an institute, you have your own institute, or you are working for an agency, or you're doing something great. Show the world that yes, you can, and you are already proven that. Thank you, and all the best to you, all young men and young women. All the best to you.